In this video, we will explain why onions, despite their reputation as a superfood, can pose a serious danger to certain individuals. We will go into detail about specific health conditions where consuming onions is not recommended, and why ignoring this information can result in serious harm to your well-being, and in some cases even threaten your life. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Avoid eating onions if you have serious heart conditions, a history of stroke, blood clotting disorders, or chronically low blood pressure. Onions are known for their ability to widen blood vessels and thin the blood due to their high levels of flavonoids, especially quercetin and sulfur-containing compounds. While these properties can benefit a healthy person, they may be harmful for individuals with severe cardiovascular issues. Consuming a large amount of onions can cause blood vessels to dilate, lower blood pressure, and reduce blood viscosity. For someone with chronic heart failure or coronary artery disease, this sudden drop in blood pressure can impair blood flow to the brain, potentially leading to dizziness, fainting, or even a stroke. Onions are particularly risky for people with clotting disorders, including those who take anticoagulants after a heart attack or stroke. Lower blood clotting ability increases the chance of internal bleeding in the gastrointestinal tract, brain, or other organs. Even minor blood vessel damage, when the body's ability to stop bleeding is compromised, can lead to serious complications. For this reason, people with serious heart conditions, a history of stroke, blood clotting problems, or chronic hypotension should be extremely cautious with onions, especially raw onions, since that is when their active compounds are most concentrated. Avoid eating onions if you have chronic obstructive pulmonary disease or frequently suffer from severe respiratory infections. For individuals with chronic respiratory conditions, especially chronic obstructive pulmonary disease, any additional irritation to the mucous membranes can pose a serious risk. Onions contain a high concentration of essential oils and active sulfur compounds that can intensify irritation in the airways. Eating onions can increase mucus production in the bronchial tubes and trigger bronchospasms, which is a sudden narrowing of the airways. For people with chronic obstructive pulmonary disease or weakened lungs, this reaction can cause severe coughing fits, shortness of breath, a sensation of air hunger, and a drop in blood oxygen levels. In the context of existing breathing difficulties, even a mild episode of bronchospasm can worsen overall health, require emergency medical attention, and raise the likelihood of hospitalization. In cases of frequent severe lung infections, such as pneumonia or bronchitis, additional irritants like onion compounds can interfere with recovery and contribute to the chronic development of inflammation. Because of this, doctors advise people with respiratory illnesses to avoid raw onions, limit how much they include in their diet, and carefully monitor how they feel after eating them. Avoid eating onions if you have been diagnosed with cancer. When a person is dealing with cancer, the body is already under extreme stress. The immune system is weakened, the digestive system often functions poorly, and metabolic processes are significantly disrupted. Onions contain a high concentration of essential oils, active enzymes, and sulfur compounds that can irritate the lining of the stomach and intestines, worsen inflammation, and trigger spasms. This is especially dangerous for individuals with malignant tumors located in the digestive organs, such as the stomach, intestines, liver, or pancreas. Even a small amount of raw onion can intensify nausea, cause abdominal pain, reduce appetite, and lead to rapid weight loss. On top of that, onions place additional stress on the liver, which is often already affected in cancer patients due to the toxic effects of chemotherapy or the presence of metastases. Medical observations show that when people with cancer regularly consume foods that irritate the gastrointestinal tract, the risk of ulcer complications, internal bleeding, and severe intoxication increases. For this reason, anyone diagnosed with cancer should limit or completely eliminate onions from their diet, especially in raw form. Avoid eating onions if you have type 2 diabetes, obesity, or metabolic syndrome. Type 2 diabetes, metabolic syndrome, and obesity are conditions linked to impaired carbohydrate metabolism, where the body struggles to properly regulate blood sugar and insulin levels. Onions, especially when consumed in large amounts, can stimulate insulin release by activating certain biochemical reactions in the body. At first glance, this may seem beneficial, but for people with insulin resistance or unstable diabetes, this spike in insulin can have harmful effects. Blood sugar levels may drop suddenly, leading to symptoms like weakness, dizziness, body tremors, and intense cravings for sweets. This is often followed by a rebound spike in blood sugar, which puts additional strain on the pancreas and further disrupts metabolic balance. Additionally, the appetite-stimulating effect of onions and their tendency to increase cravings for carbohydrates make it harder to manage weight. In people with metabolic syndrome, this can result in poor dietary control, episodes of overeating, and weight gain. Dishes that contain fried or caramelized onions are especially problematic, as they have a high glycemic load. That is why people with type 2 diabetes, obesity, or metabolic syndrome are advised to limit their intake of onions, particularly in raw form or in large quantities, in order to prevent blood sugar fluctuations, episodes of hypoglycemia, and difficulties maintaining a healthy weight. Avoid eating onions if you have been diagnosed with Alzheimer's disease or other forms of dementia. Alzheimer's disease and other types of dementia are associated with severe impairments in brain function, including memory loss, decreased attention, and reduced ability to think logically. In these conditions, the body becomes especially sensitive to any internal fluctuations, including changes in blood sugar levels and blood pressure. Onions contain active compounds that can dilate blood vessels and influence glucose metabolism. In older adults with dementia, this can lead to sudden shifts in blood pressure, either rising or dangerously dropping. In addition, the way onions stimulate insulin production can cause instability in blood sugar levels, which is especially risky for the brain since it already suffers from reduced energy supply. Clinical observations show that when people with dementia experience fluctuations in blood sugar and blood pressure, their short-term memory often declines further, disorientation and irritability worsen, and the risk of falls increases. In more severe cases, vascular instability may accelerate the progression of the disease and even trigger a stroke. That is why it is important for individuals with Alzheimer's disease or other forms of dementia to avoid foods that can disrupt metabolism and vascular stability, especially raw onions. Avoid eating onions if you have an advanced stage of chronic kidney disease. The kidneys play a crucial role in removing excess potassium from the bloodstream. In the advanced stages of chronic kidney disease, their filtering ability is significantly reduced, and even small amounts of dietary potassium can become dangerous. Although onions are often considered a healthy vegetable, they contain a relatively high amount of potassium, about 146 milligrams per 100 grams. For a healthy person, this is not a concern. However, for someone with severe kidney failure, even just a couple of servings of onion-containing salad can trigger hyperkalemia, a potentially life-threatening condition where potassium levels in the blood rise to dangerous levels. Hyperkalemia disrupts the heart's electrical activity, leading to arrhythmia, a rapid heartbeat, weakness, dizziness, and in severe cases, cardiac arrest. Medical studies show that even a single spike in potassium levels among dialysis patients can raise the risk of life-threatening complications within the next 24 hours. That is why people with chronic kidney disease must carefully control their potassium intake, limit foods like raw and cooked onions, and work closely with a nephrologist to manage their diet. Avoid eating onions if you have cirrhosis of the liver or other severe chronic liver diseases. Cirrhosis is a condition where healthy liver cells are replaced by scar tissue, disrupting the normal function of the liver. In this state, even mild stimulation of the liver can lead to serious consequences. Onions have active biochemical properties that stimulate bile production and increase metabolic activity in liver tissue. While this effect might be beneficial for a healthy liver, it creates unnecessary strain on a damaged one. In cirrhosis, any attempt by the liver to work harder can lead to further destruction of its structure. Additionally, the increased bile production triggered by onions can cause bile to stagnate in damaged ducts, leading to inflammation and further worsening of the condition. Clinical observations have shown that patients with cirrhosis who consume foods that stimulate liver activity are 28% more likely to develop complications such as ascites, portal hypertension, and hepatic encephalopathy. For this reason, individuals with cirrhosis or other serious chronic liver conditions must avoid foods that place extra stress on the liver, including onions in any form, raw, cooked, or fried. Avoid eating onions if you have gastritis, peptic ulcers, or irritable bowel syndrome. The lining of the stomach and intestines serves as a protective barrier against harmful external factors. In cases of gastritis, peptic ulcer disease, or irritable bowel syndrome, this barrier is either damaged or inflamed, and any irritant can cause a sudden worsening of the condition. Onions contain a high concentration of essential oils, organic acids, and sulfur compounds that can aggravate already inflamed tissues. When people with these conditions eat raw onions or dishes with a high onion content, they often experience sharp pain in the upper abdomen, heartburn, a feeling of heaviness, bloating, and sometimes even nausea. Studies show that in individuals with gastritis or ulcers, regular consumption of raw or fried onions increases the risk of flare-ups by 30 to 40%. In more severe cases, bleeding from damaged areas of the gastrointestinal lining can occur, requiring immediate medical attention. Onions are especially dangerous during periods when the condition is actively flaring up, as the mucous lining is at its most vulnerable. That is why people with gastritis, ulcers, or irritable bowel syndrome are strongly advised to completely avoid raw onions and to approach even cooked onions with caution, ideally after consulting a gastroenterologist. Avoid eating onions if you have chronic pancreatitis or other pancreatic disorders. The pancreas is one of the most delicate organs in the body and is especially sensitive to anything that stimulates digestion. In chronic pancreatitis, the tissues of the pancreas are inflamed and weakened, and its enzyme activity can easily become unregulated. Onions, especially when raw or fried, strongly stimulate the production of digestive enzymes. This reaction is triggered by organic sulfur-containing compounds found in onions, which irritate mucous membranes and activate the digestive system. In a healthy body, enzymes are released to help break down food, but in someone with pancreatitis, these enzymes may start digesting the pancreas itself. This can lead to a severe flare-up, including sharp pain in the upper abdomen, vomiting, bloating, and disruption of digestion. According to data from the American Gastroenterological Association, more than 40% of people with chronic pancreatitis have experienced flare-ups triggered by foods that are hard on the pancreas, including onions. For this reason, individuals with chronic pancreatic conditions are advised to completely avoid raw and fried onions and to consume even boiled onions only in very small amounts and only after consulting with a doctor. Avoid eating onions if you have been diagnosed with gallstone disease. The gallbladder is a small organ that stores bile, which is essential for digesting fats. In gallstone disease, stones form inside the gallbladder and can remain unnoticed until something triggers them to move. Onions have a strong choleretic effect. Their bioactive compounds stimulate the contraction of the gallbladder and promote bile release. If stones are present, this stimulation can cause them to shift and block the bile duct. This can lead to a sudden and intense pain in the upper right side of the abdomen, often radiating to the back or shoulder, a condition known as biliary colic. Such episodes frequently require emergency hospitalization, and in some cases, urgent gallbladder removal surgery. Medical statistics confirm that for patients with gallstone disease, the risk of an attack increases by 35% after consuming foods that stimulate bile production, such as onions. For this reason, people with gallstones must strictly avoid foods that provoke gallbladder contractions, including onions, in order to prevent acute complications and protect their health. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.